Complications happen. How can you dodge the botch blow? Oh gosh. Okay, just,
Edit it out.
yeah. Complications happen. How can you dodge the botch bullet? Hi everybody, Dr. Anjana Bana here, and welcome back to my YouTube channel. So I was just talking about complications, and this is another video about possible complications and side effects as they apply to botulinum toxin. Still the most done non-surgical aesthetic treatment there is out there. So it's botulinum toxin, dermal fillers, microneedling, chemical peels, and I'll just have to check on the fifth one. It used to be microdermabrasion, so I'll have to just double check on that. It could be that, but the top four are still the mainstay at all aesthetic clinics. So let's talk about botulinum toxin. We just did a video on filler complications, and when we go through the informed consent with the patient, so often when we go through the informed consent, and if the patient has been, sometimes they've been elsewhere, or they've even been to one of those Botox parties, they haven't gone through or done an informed consent. And it's often like, was this discussed previously? It's like, no, I'm not sure. So aesthetic veterans and patients that have been doing these procedures for years might need reminders as well. So even if you've been doing this for a few years, we never take it for granted. So every single time you come in, you sign and have a look at the informed consent, and every single time you will get verbal instructions as well as written, like digital instructions, post-treatment instructions, and you get a check-in and you get a follow-up. Not everyone comes for the follow-up, especially if they've come so many times, but it's really important to check on the results, on the symmetry, on the safety of the patient. When we consent for botulinum toxin, we say, it's a scheduled drug. Some of the areas that are done are off-label or academic uses. So say we're talking about cosmetic botulinum toxin, the frown, the forehead, the area around the eye. So when I started, the only area that was FDA approved on label was this area, the frown area. So the last area to get approved for that cosmetic use was the frontalis muscle, and then before that the crow's feet. But things like DAO, platysma, nasal flaring, the chin, microtoxin, all of those things are off-label academic uses. So just bear that in mind. It doesn't mean it's not safe. It just means that it hasn't been approved by the FDA as a treatment. But it's also been done academically, so much so there is going through, like any time a needle touches your face, one of the complications that can happen would be an infection. I think this would be we've never had one, touch wood, I'm going to try and find some wood, but we've never had one. You have to have good cleansing, no trace of makeup, disinfection before, during, and after the procedure. So, but that is always still a possibility when any sort of treatment is done, including botulinum toxin. Redness at the site, itching at the site, a possibility of bruising. Even though the needles are tiny, it is still a possibility, especially around the eye area. That can happen. Thankfully, it's relatively rare. The other thing is, and we have it in our informed consent, is nodule formation or irritation. So this has been coming up as a topic, in our little aesthetic groups, that with the botulinum toxin, some patients are presenting with prolonged nodules or heat around the site, some redness that shouldn't be there. It usually resolves by itself or resolves with a cortisone, but it's something that wasn't seen previously. So some of the things could be that, injected where there there was some topical anesthetic not properly disinfected off, or it could be the silicone from the syringe, the irritation from the toxin. They've even said, it could be a possibility of COVID. Nobody really knows, or the saline that's used. So nobody really knows what the reasoning for that is, but it can happen and does happen. It's probably really, really under reported, but someone will mention something, it's like, yes, this happened to me, yes, but it's not officially reported as an adverse event to the company. So that is something that is a possibility. And it's also happened to me once. Perfectly resolved. The results are also exactly the same. However, I did report it to the company. The other thing that we have in our informed consent, but with the cosmetic doses and even hyperhidrosis, it's quite rare to have systemic muscle weakness, flu-like symptoms, a headache. That is also a possibility. So what's been doing the rounds on social media, and there'll be a little insert of it here in one of the corners of the video, is a patient went to see someone for some botulinum toxin for her migraines, and then ended up having to have antitoxin because she couldn't swallow properly, she couldn't hold her head up properly. She had to be rushed to ICU because botulinum toxin is a neurotoxin. We must remember that. And from what came out of it, I think the practitioner that was injecting was not injecting legit botulinum toxin from the known approved brands, and it was some sort of fake tox, which is also available in South Africa. There was something called blue Botox, they'd call it, and that wasn't something that was approved in the country. Apparently it was from Korea. So it's really important, like, this is a neurotoxin. How is it made? How is it purified? What is the amount in that vial? Things like that you should know. And when you get these botched things, like people buy them online, you don't know. And we must remember, this is a safety and health issue. But thankfully, that patient was seen. She's in the States, I think. She was seen and she was helped, and she is well now. So I'm glad she's well. So that is one of the serious things that can happen, especially for extensive, like the higher units of botulinum toxin that is used. The other sort of side effects are more cosmetic. So the one would be a lidosis, so where your lid is a little bit droopy. It happens usually when injecting the frown line, and usually from this point here, it tracks into that muscle that lifts the lid, and then you get a bit of a lidosis. There's also a brow ptosis, so your brow feels heavy and droopy, and that's usually injecting a lot of toxin here. Or you can get a pseudo brow ptosis, where you've got a lot of like heavy skin around the eyelid. And usually when I see this, I often suggest a consult with an oculoplastic surgeon, because sometimes it's like a medical and functional thing, having that excess skin. You can't see superiorly, you can't see out the top of your eye. And then what people do is that they like lift their eyelids constantly. It's always tense here. Once that is relaxed, drop. So a pseudotosis of the brow. I've discussed this before. So when you inject these muscles here, the SAD muscles, like the DAO, it can track to the middle, and even the chin muscle, the mentalis, it can track to the sides and affect the DLI, the lip depressor, and then you can get a skew smile. If you're doing the crow's feet area, there's a fine line, so you can't be completely frozen. You have to, like, some people want the complete frozen look, but most people don't want that. But if there's too much toxin injected, or if the toxin is a little bit off the orbicularis and into the zygomaticus, you can get a flat smile. You can even get a down, like, sort of droopy smile. The masseters, these muscles, these powerful muscles of the jaw, often injected. I would advise against facial slimming. Then people are upset because you get like a non-support, you get more jowling. So I don't often do it. I don't never do it for facial slimming, because This is a functional muscle. Yes, for pain, especially if you've tried bite plates, you've tried other therapies, and it's something that gives you that relief. Yes, we do it, but it has to be injected in a certain way at a certain depth, or you can get popping out of the deep head of the masseters. So that is something weird that can happen in terms of, so mostly cosmetic things, sometimes also around the eye. Some people have some light sensitivity. So all of these things you have to consider, and you have to think really deeply. Your face has to be properly examined, the way your muscles move, and that completely frozen look is out now, and sometimes it's not achievable. So as we age, say you've been getting toxin for 10 years, so what you did 10 years ago won't apply now. You've lost, like, you've got bony resorption, your muscles are different, your fat pads are different, and then what you did in your forehead, you can't always carry on and do, because you've got laxity of the skin of the lid. So sometimes we have to make a compromise as we age, especially with botulinum toxin, and then the focus should be on skin quality. If you have any questions about what I've said, and like the informed consent before doing a treatment, as well as some of the complications, as well as the benefits, there are lots of benefits to botulinum toxin, please drop them in the comments down below. Like, share, and subscribe. Bye.